A good day has a lot to do with your GNA. They start the day off for you. They're the first ones to come in the morning, and you deal with 3 GNAs a day.
For us, a good GNA is a person who gives us kind, compassionate care. A nursing assistant who is happy to do a good job, and someone who tries to understand our needs and problems will make a huge difference in our lives.
A good day is when you have a nursing assistant who is helpful, who is kind, is happy, and who seems to enjoy her job. And so many times they're just doing a job. But I think it's important for the resident to have a nursing assistant who enjoys what she's doing.
A good GNA tries to understand your situation and your problems. And then some of them do that too, and they talk to you and try to help you.
It's just so wonderful when you know that you can ask a nurse if you need something and they don't mind, helping you. And it's just a relationship to me, I'm a mother and they are my daughters, That's the way I feel about them.
What makes a difference that I think all nursing assistants everywhere need to know is communication. Come in and communicate with the patient. Even if it's a patient that seems to be in a coma or semi-coma, talk to the person. You've never been in a coma yourself. We don't know what state they're in. Maybe your voice, being kind and a little caring can make all the difference in the world. And around here, it makes my day. It really makes my day.
Our advice to GNAs would be to have a positive attitude, patience, and a caring manner. Don't take offense at our suggestions for our care. Also, please remember that each of us is an individual with special needs.
I would like them to know if you don't have the attitudes, the patience and all, that you shouldn't take up this profession, because you have to know how to be kind to people and understanding, and it's a lot of things you have to know, because some people really don't have the patience.
As far as the GNA goes, they have a certain job to do. And like everything else, there are people who are devoted to their work and people that are not devoted to their work. When you want to do, you're devoted to your job, you do a very good job and you'll always succeed in what you're doing. If you don't want to be such a good, devoted person, you're only going to get a paycheck, because that's what you're here for, to get a paycheck. You're not going to do the job you're supposed to do, not the job you were trained for, at least. And that's one of the biggest problems in CGNAs.
Don't take offense. Don't be so quick to take offense when I'm offering you and I'm telling you the little things that, in particular, the way I like them and what's going to make me comfortable. In some occasions, someone will say, well, I've been doing this job for 15 years, Ms. Ball. I've been doing this job 5 years. I've been doing this for 20 years. And I say, I understand. And I respect that. And I believe you. But you've never had me before. I need for my pads to be a certain way under me, more than what they normally do. I need, when you turn me, to be careful, because I also have scoliosis as a result of my multiple sclerosis. So you can't just turn me to the side and think I'm going to hold still there, because my body's sort of in a S shape. And I have to let them know that, because they just so used to flipping you over and thinking you're going to stay that way. And I say, no, but there's a way of doing it. If they just listen and follow the instructions, there's a way of positioning me to keep me there. I'm comfortable, I'm still, and you're able to get your job done effectively and sufficient.
Remember that we can't do some things on our own and really depend on you. Take the time to make sure we're comfortable. Make sure things are in reach, such as the call bell, the remote for the television, and the telephone. Please be gentle and attentive when caring for us. And finally, remember to communicate with caregivers on other shifts to stay up to date on our care.
On a scale of 1 to 10, it's a 10, because being comfortable is very important.
I usually get my water in a certain area, and like my television, another area, just to turn around.
Maybe doing some odd and end things that you want done personally that you can't do yourself, they might do for you, you know. Go get something out of a drawer or a closet which you can't get in or something like that. That's what you look forward to.
Range of motion, 3 times a day, every shift. Move my arms and my legs because I can't move either arm without any assistance, only my head, and it's very important. I'm glad you mentioned that because it's something that can be easily overlooked and taken for, well, that's not important. But when your blood is not moving and you're just laying there, you're at risk for a lot of things, especially blood clots, and they're really dangerous. And when they just take a few minutes and range your arms and legs, it not only feels good, it relaxes you, your blood's moving, and it's a wonderful thing.
And your natural kindness will help a lot of times. Just be kind to people. You know, like an old person, when you pat them, and I saw a couple of them give them a sip of water. They react to that, you know.
And it also helps when they leave you, before they leave at the end of their shift, to please give report to the next person coming in. That prepares them, whether it's a stranger or a regular. They didn't have you the last 8 hours. You give report to the next person, they feel more prepared before they even walk in the room because they know what's going on with you, and that's a lot better.
There are several things we appreciate when you come into our rooms. We appreciate when you're personal and friendly. A smile goes a long way. Being professional and efficient with our care makes things go as smoothly as possible. Taking your time with us when giving care and listening to any concerns or problems we might be having is always appreciated. Finally, it's critical that you check the posted charts so you can follow instructions concerning our care.
Well, one of the most important things I can reiterate on is when they come in to speak, and then what kind of day you're having, and the care they take in doing your vital signs. They don't just throw you around, move your arm, taking time with that, listening to you, and realizing that I know their job is over and over and over, vitals to everybody, but they have to realize every individual is different, and you have to be careful in how you handle them.
Well, good morning. How you doing? Are you ready? And I might just say, hold my arm, and I can stand up and pivot and just pull the chair forward. And I can set my buttons down, you know, ready to go, and help me to lift my leg.
And if they come in with a smile, I'll smile too. And if they'll speak in a nice way, that's very important. That makes it a good day. And if they know their jobs, that also makes it a very good day.
Just show me who you are and what you want me to do. And that's how I best do it. And the other thing is be careful in reading these signs. Above my head, in every room, they have signs above the patient's head telling you important information about that patient. Take a few minutes. You don't have to memorize, but familiarize yourself with them long enough to know who's allergic to what, who can do this, who can't do that, things like that. It really helps the patient, and it helps you, because your day will go a lot smoother if you know what's going on.
There are several ways to make our AM care a better experience for us. When it comes to dressing, bathing, and grooming, give us choices and respect our wishes. Please allow us as much independence as possible. Make our care as enjoyable as possible, because a little attentiveness and pampering can make it a great day.
The nursing assistant that I have regularly, I don't like to get up early. So she comes a little late to get me up. But when she does, if I don't want to get up right away, she'll get me all washed up and everything. And then she'll come back and put my clothes on me and get me up.
And sometimes they don't like touching me. They don't like hard. I like when they rub me hard. It feels good.
It's wonderful. If I say I don't put soap on my face, they don't do it. And anything that I ask done, bathing, they will do it. Put the lotion on me like I want it and everything.
I love to dress myself, but I can't stand all the way. So with assistance, hold my arm and I can stand up and pivot and then pull the chair and sit down.
I know how I like to dress, and I like to be coordinated and everything, and she knows this also. And I have too many clothes, so she'll have to be pushing to find what I want to wear, and we laugh about it.
When we ring a call bell, we need you to respond as quickly as possible. Remember, we depend on your responding. Your responding to our ringing could be critical and even life-saving. Please respect our judgment when using the call bell because most of us only use it when necessary.
When I ring the call bell, I've dressed and I'm ready to get from the bed to the chair, ready to go.
It's everything. It's everything. Seconds around here really count. They're life-saving. In a lot of cases, I have witnessed it where it saves lives.
When you need something and you need it fast, you ring the call bell.
Where I had trouble with breathing or infection, I didn't know what the problem was at the time. All I knew was I was having problems breathing or couldn't get something right. And I would blow that call bell and I would look towards the door to anybody walking by and just gesture with my head, and they knew something must be wrong with Miss Ball and get in here right away.
I don't ring it unless it's absolutely necessary.
Many of us in long-term care live with pain as a part of our daily life. Please take our pain seriously. We need to know we can rely on you for help. Remember, our comfort depends on you. It is also important to remember that we have feelings, and emotional pain can be very upsetting.
Pain relief is very, very important. And not only is it sometimes not given on time, sometimes it's not given at all, and that's wrong.
Because even something as simple as adjusting the head pillow means all the difference. If it's too much to the left, I'm tilted. And I'll be that way till you come back. I can't reach, I can't move myself. I'm just stuck in that position. And it's an awful way to be. And it's as far as other things to make you comfortable. The sheets. I can feel from the breastbone up. I can't feel anything downward. But when the sheets are crinkled under you and you get marks and you can't straighten them out, that's very uncomfortable. So if they just take a few minutes and pull your sheet up and make sure it's smooth, that keeps me comfortable for hours.
I know once I asked a nurse if she would get tissues to help me blow my nose. And she said, blow your nose? I'll get some paper towels and you can blow your own nose. Now that really got me upset. It really did. Because if I could have done that, I could have gotten the tissues and done it myself.
We think that our relationship with you is a special one. Your relationship with us is very important and often becomes close and personal. We rely on you for emotional support as a care provider and friend. Remember that you make a difference in our lives.
It's like a daughter. She is just like a daughter. I don't have any, but she's just like a daughter would be. And she does everything.
You can talk to them, I'll tell you that. You can talk to them, tell them the truth. You don't have to lie, because I don't care anymore. I tell them the absolute truth. What my feelings about them are. And if they're stupid, I tell them they're stupid. And they tell me the same thing, and worse. And I like that.
I can tell if it's a bad day with a regular, not because they're nasty, you just get used to their mannerisms. And you know everybody has a bad day. And I can tell from their facial expressions, this is not a day to pick with this one. Or you know, I can tell when they're smiling. They can tell my mood. They know if something's wrong with Miss Ball. She's not talking so much. Something's on your mind. What's the matter? And they really care. And we care about each other.
Try to do your best, you know. It helps. It really helps.